We are back with Cone Health nurse practitioner Hannah Mills to talk about all things virtual care. And we've thrown this around a few times. Go to MyChart. Just go on to MyChart. So some people might be like, I don't know what MyChart is.
Yes, so MyChart is your patient portal to Cone Health. So if you go to a Cone Health office, you can have a patient portal that you can communicate with your providers or the nurses and the staff, see your results. And this is what allows you to have the virtual appointments.
All right, and this is super handy because you can go, like if you've had a physical or something done, you can actually see all of your blood work and stuff like that before, you know, the office would even be able to call you. So, I mean, it really is a good resource, and you can talk to your doctor back and forth. All right, so let's talk about how virtual care can help out, especially when we're traveling for the holidays.
So virtual care is a wonderful option if you're traveling for the holidays. It's great to do if you're, going out of town to see some family, you started feeling bad, or you thought you got exposed to the flu. Hop on, get a visit, and we'll get you taken care of.
All right, but what about if you're traveling outside of North Carolina? Can you still use this?
So yeah, we can certainly see you. Our one thing is that it's a national thing. Every provider has to be licensed in the state in which they prescribe medicine. So if you're not in North Carolina and you see a North Carolina provider, then you won't be able to be prescribed medicines, but we can kind of help you work out what's going on and direct you where you might need to go if it's an emergency.
Okay, so with flu, RSV, COVID in our community, some people may not want to go in for health care. So this would definitely be an answer to that instead of just skipping health care.
Oh, most definitely. Stay in your pajamas and stay at home. Be comfortable. So you can make a virtual care visit. It's a great option to do, especially when you want to avoid it, giving it, and avoid, receiving it. So yeah, any flu or like virus related illness, stay at home, be comfortable, sit on the couch. We don't mind what if you're comfortable, we don't mind. So just hop on, make an appointment, and we're glad to see you. And we'll tell you if you need that in-person evaluation, we'll direct you where you need to go.
All right. Now, what about this? What about if you see the doctor and then the next time you're supposed to like follow up like in a week or 2 weeks or something like that, can you make a virtual visit instead of going back into the office?
Yeah, so all of our Cone Medical Group practices offer virtual care options. So if we say, hey, follow up with your primary care provider, it's easy in a safe way as long as your primary care provider feels that that is appropriate. So we don't ever want to over succeed your provider. So if they think that it's appropriate, then most certainly you definitely can do this virtually.
Okay, so as long as they think that it's safe for you to do that, I understand.
Yeah,
so how much does the virtual care cost, and then how do you pay for it?
So we are billed like primary care appointments. Usually you have your primary care copay with us, but it does depend on your type of insurance. I would always say it's a good idea to contact your company prior to making a virtual appointment to make sure that you know what kind of coverage you're looking at. And then I can tell you that our e-visits are $35. Those are the questionnaires that are like an email that go back and forth. Those are $35. But the other appointments of the video appointments, they're billed just like a primary care appointment would be.
Okay, just like you would go in and normally pay your copay. How do you sign up for virtual care with Cone Health?
So we have two great options here. You can go to the website, www.conehealth.com/virtual care, or you can also text FLU, FLU, to 39417.
Okay, let's say that one more time. You can text the word flu to
39417, and that'll text a link back to your phone, and it'll take you to the website that I just said.
Okay, all right, that sounds good. We appreciate your time and your expertise and laying it all out there.